everyone, once again welcome to my Oet channel. Today I came with exam introspection, that is today's exam 25 March 2023. So just I have an overall idea about the exam, so we will have the discussion. First we will go to the writing task. So this writing task, it was unknown case, and the letter is directed to a community health nurse, but there was a little bit confusion because the address was same, but patient stays alone in the home and we are writing the letter to community health nurse. So it is a pure unknown case, and in this case note we can see that patient's name is Mr. James Mackey and he is 76 years old, and he was diagnosed with a gastric cancer and was scheduled for the surgery. For the date was 26 December 2022. Okay, and today's date, as usual, it was 8 January 2023. So in this case note, actually the writing task, it is write a letter to community health nurse requesting post-operative care needs and just explain regarding the present surgical history. So this was the writing task, and in that we can see that this patient during hospitalization, actually post-operatively, actually after the surgery, the patient has undergone partial gastrectomy along with jejunostomy pump fixation. So they have attached with the jejunostomy pump for feeding. So after the surgery was successful, and post-operatively actually they have started NG2 feeding. In the initial stage and all, they have initiated the feeding with the NG2 feeding, and gradually they have shifted to jejunostomy. So when the esophagus became completely healed, then they have started jejunostomy feeding, and they have managed conservatively during the hospitalization, and they have mentioned that there is no need for the dressings and all. Because there is a risk for infection or something like that. Then gradually today he made progress and ready for discharge, even though he requires some assistance from the community health nurse, especially for the feeding and for the review of any infections, to monitor any infections or the calorie intake, and to because it's a gastrectomy patient, partial has gastrectomy patient, so they should maintain a proper dietary regimen to avoid some post-operative complications related to diet and all. Even though with every instruction, of course the patient could not take care herself because he is already 76 years old. So that's the reason we are writing the letter to the community health nurse. And they have given some old history, like during the December times, he was confirmed with 26 December 2022 is the surgery date. Before that, initially he presented to the family doctor with the complaints of indigestion and sudden weight loss. Then he was advised for the gastroscopy plus biopsy, and in between he has undergone the CT scan also. All these diagnostic evaluations confirmed stomach cancer. That's why they have confirmed the surgery. So this is the overall idea. And regarding the recommendation paragraph, they have given some more recommendation, like the important thing is for the dietary regimen. The dietary regimen how to be monitored, and we are requesting the community nurse to provide assistance in jejunostomy feeding until his calorie intake is sufficient. Then the another one is monitor the dietary advice, whether he is compliant with the dietary advice or no, and if there is any signs of infection. And they have given one review. They have fixed one review after 1 month with the dietitian. So there is a scheduled appointment for the dietitian for the follow-up. So this was the content they have given in the case note. With this one, the letter is very easy. Actually, I will provide a rough outline. So the date, as usual, we will write 8 January 2023, and I don't know whether community nurse's name is given or no. Anyway, if it is there, you can write with the community nurse's name and address. Then we can start with the name if it is given, or as dear nurse. Regarding Mr. James Mackey, aged 76. Introduction will be, I am writing to refer Mr. James Mackey, who is recovering from partial gastrectomy. He requires ongoing post-operative care following his discharge today. That's enough. Okay. So I am writing to refer Mr. James Mackey, who is recovering from or who underwent or who has undergone. We can write in all ways. Partial gastrectomy. He requires ongoing postoperative care following his discharge today. Okay, then we will move to the present medical paragraph. In present medical paragraph, we can just expand the letter, means we can start with the initial things and all. We can start like this. Initially, Mr. James presented to his family doctor with the complaints of indigestion and unintentional weight loss. Subsequently, he underwent gastroscopy, computerized tomography scan as well as biopsy, which revealed gastric cancer, therefore, he underwent the surgery on 26 December 2022 successfully. So this is a lengthy sentence, but we can combine all the things togetherly in this single sentence. Then along with that, you can write, in addition, he was connected with the jejunostomy pump for feeding. Okay, so this much you can write it in the one paragraph of the present medical. Initially, Mr. James presented, initially Mr. Mackey presented to his family doctor with the complaints of indigestion and unintentional weight loss. Subsequently, he underwent gastroscopy, computerized tomography scan and biopsy, which revealed gastric cancer. Therefore, he underwent the surgery on 26 December 2022 successfully. Full stop. In addition, he was connected with the jejunostomy pump for feeding. Okay, the next paragraph we can write about the hospitalization. Post-operatively, Mr. Mackey's feeding was managed with a nasogastric tube feeding until healing of esophagus, followed by jejunostomy feeding. So currently he is on jejunostomy feeding. Or else you can use even post-operatively Mr. Mackey's feeding has been managed, like that also you can write, with the has been also you can write. Or else was managed with an nasogastric tube feeding and has been initiated with the jejunostomy feeding, like that also you can write. Okay, then gradually his staples were removed and he attained progress, even though, follow-up attention from your service is essential for his well-being. Okay, so this is the second paragraph. I'm not sure about is there anything is there during hospitalization. I got only this much idea. Okay, so post-operatively Mr. Mackey's feeding was managed with an nasogastric tube feeding until complete healing of esophagus and has been initiated with the jejunostomy feeding thereafter. Then gradually his staples were removed and he attained progress, even though follow-up attention from your service is essential for his well-being. And regarding the social paragraph, I got only little content. Mr. Mackey is a divorcee and drinks alcohol 2 to 3 units per day. Remaining social things and all, I'm not sure. If I will add it in the fair letter, okay, in the next video. Then the recommendation paragraph is very much important in this case. In this letter, it would be appreciated if you could monitor Mr. Mackey's dietary regimen and provide assistance in jejunostomy pump feeding until his calorie intake is sufficient. Then please assess his compliance on dietary advice as well as any signs of infection. Please note he has a review appointment after 1 month with dietitian. Okay, so these are the recommendations. It would be appreciated if you could monitor Mr. Mackey's dietary regimen and provide assistance in jejunostomy pump feeding until his calorie intake is sufficient. The next point is please assess his compliance on dietary advice as well as any signs of infection. The last one related to the review. Please note he has a review appointment after 1 month with the dietitian. Then the conclusion thing will be, if you need any further inquiries, please do not hesitate to contact with me. Then if the name is given, yours sincerely. If the name is not given, yours faithfully, Sternus. So that's only the thing related to the writing. So I hope it is clear. And in the next video, I will just post the fair letter. Okay. Then regarding the speaking, actually I got 6 topics, something related to community health center. There was a mother and baby, and the content I'm not sure detailedly, but there is in-house emergency department also. There was one baby and mother with a burn. Baby came with the burns and management and advices, everything. Another one speaking card was in hospital ward with the overdose of drug. So we had one card same like this with the overdose of drug it is in the emergency department. I think same, more or less same thing. So we have to ask about the drug name and how many tablet they took and any symptoms they are experiencing now, what is their general condition, if they have any old history or something like that, we can ask, and we will triage the patient, and we will arrange the doctor's assessment. Of course, it will be a clinical observation. Okay, and another one is in emergency department. One patient, female patient, 35 years old patient, came following a fall, and she's complaining pain in arms. She want to see the doctor immediately. So in that cases and all, we are asking the patient's detail, where is the pain and what is the score onset and what is the exact incident, and if she has any past present medical history or any surgical history, is she on any medications. These all histories and all, it will come. And another one is in the hospital ward. One patient got admitted after the side effect with the chemotherapy. So after initiation of chemotherapy, he or she got some side effects, and now the admission, it is for immunotherapy or any alternative therapy. So actually in this scenario, we are going to do the clinical observation. For clinical observation, we are just asking the patient's condition, how he or she is doing, and we will explain regarding the continuation of chemotherapy. Same like this one card also, we used to practice in the earliest. There is one earliest card in my Telegram group. If you search, you can find out, or else in the playlist also you can search under the role play, Oet role play. Okay, and another one is the procedure, that is ECG. The same card also, we had it in our Telegram group, and of course it will be related to the action. We'll ask about the current situation. We will explain regarding the action of the ECG and the procedure, and what are the precautions we have to do, and regarding the reports, everything. So this all the content I got it from students, and more or less same. It's like a same model type of questions what we used to practice. Okay. And regarding reading, actually in European country, there was in reading, they got, even writing also, they got different question paper, and even reading and listening also, they got different question paper. And European countries, the reading part A was gallbladder stone. So they have given like definition, types, diagnosis, surgical management, acidosis treatment, and complications, and it was pretty easy. And in India and Bahrain, Kuwait, Middle East and all, there was reading was regarding cardiac condition, pericarditis. Okay, acute pericarditis. It was different. Anyway, it was a condition, so it was easy, I hope. And regarding the listening module in European countries, it was ophthalmology. In the A part, it was ophthalmology, and another one is for orthopedic. And in India, I'm not sure about these things and all. I hope the same thing only. Anyway, everybody's opinion is that writing was easy and speaking was also easy. Reading A part and listening A part was easy, but B and C part of listening and reading was somewhat tough. As usual, it is quite normal. In every question paper, we can see that listening part A and B, reading part A, listening and reading part B and C will be somewhat tough, but A part will be somewhat, it is good. So this is the overall idea of our today's letter, and I just want to explain another one more thing with you regarding the writing task in European countries, in New Zealand and all. The writing task was different, so I will just give you the overall idea. Actually, this one was non-case, but it is nursing home. The address of patient address and reader's address was same, and as usual the date is 8 January 2023, and this patient is 85 years old, female patient. Actually, since 2017, she is residing in the same nursing home, and recently she got fall. She had a fall and got admitted in the hospital. She has undergone X-ray, which revealed a fracture in the left wrist. Okay, and after subsequently surgical alignment has done, and with the cast application. So with the surgery, then cast also applied, and post-operatively she was managed with analgesics, that's conservative management, and during hospitalization she was found to have decreased urinary output. So she was educated regarding the risk of urinary tract infection and the need of increasing oral intake. Okay, so that is the thing. As well as we educated regarding the mobility and exercises also, because the problem in hand. So we have explained regarding the hand exercises and the hand exercises and finger exercises also. Then actually she, because of fall, she had lowered mobility, so there is a problem with going to toilets and all. So that all the thing, that is the current situation, her current situation. Then and the writing task is ongoing. We have to write about the ongoing needs and the monitoring, briefly explain regarding the hospitalization. So in the recommendation no need for social paragraph. In the recommendation paragraph, we have to write that it would be appreciated if we could monitor this person's patient's pain, mainly monitor the pain and sensation of hands. Okay, so that is important thing. And another one more thing, encourage her for mobility and to perform hand exercises as well as finger exercises. Then another one more thing, kindly assess her for toileting if she required to move, because of all she has decreased mobility. So if she required, they need to give assistance. The last point is she has a follow-up after 2 weeks. Okay, so these are the content of that letter. It's a non-case, but nursing home non-case. Okay, they used to give the same address, with that we can find out. So I hope everything I have covered. Anyway, in next videos, these 2 letters, I will try to prepare a fair letter, so it will be easy for you. But question paper will not be there. We have to refer in this introspections only, then you will get an idea. Then we can see the letter. So I hope everything is clear, and those who are going to write exam, so just go through this all the type of questions and all. If you see in YouTube, you can see many introspections in 2022 and 23. Just go through with everything, then you will have an idea how the pattern of question papers, especially in 2023. If you follow many question introspections, exam introspection, you will get an idea, because last 2 exams were non-case for family doctor, and this time it came like unknown case, but in some countries it was again non-case but with a nursing home. So it is like it's coming like alternatively with the doctor and nurse, only doctor and nurses, no other non-medical, but we can expect even non-medical also. But please try to see the old question papers and the way of writing, so that you can refer my Telegram group, or you can go to my playlist, YouTube playlist, and you can see old exam questions or exam introspection. Okay, so that you will get an idea how was the exam, how was the writing task, and the fair notes, and only how to refer the fair letter also. Then only you will get an idea how to write the current letters and all. Okay, so we will see with another one informative video. Till then, bye, take care.